Manganum is a very useful homeopathic medicine. It is derived from a metal, manganese, which is situated in the first line of periodic tables. So it is an element, manganese, from which our medicine manganum is made. Along with this, other metals are iron, cobalt, and nickel that are situated next to manganum in periodic table. And miasm is psychotic. So here, two things that you have to remember is the manganese metal and psychotic miasm. Now, let's start with the mental symptoms of manganum. The mental symptoms are few but very striking. Like there is great apprehensiveness or great anxiety and anticipation. Okay, so something is going to happen. This fear is situated in the mind of a manganum patient. Something awful is going to happen, and the patients try to occupy his mind, but nothing works. He cannot take off his mind from something awful that is going to happen. But when he lies down on bed, then there is amelioration even in the mental symptoms, also in cough. So this is a striking feature that cough and anxiety, these both symptoms are relieved by lying down. Okay, so the obvious statement is now bedridden woman who loves to keep still, because that's the only way the patient can get relief. So that is the mental picture of manganum. Now we have is aggravation from damp weather. Now we had amelioration from lying down. Now we have aggravation from damp weather, which is also seen in Dalkamara. So mostly the symptoms that are increased during damp weather are ENT symptoms. Okay, so he is deaf whenever the cold rain comes. Whenever there is a rainy weather, he will have trouble in ear, in throat. Okay, so there is soreness along with burning and itching in auditory canal. Okay, cough from itching in auditory canal. So patient says that he has cough whenever he itches his ear. So that is also seen in Kalikarp, Silesia and Manganum. Cough from itching in auditory canal. Now we have is the complexion is waxy and pale. Now waxy and pale complexion are seen in patients due to bleeding with the hemorrhagic diathesis. Okay, so if there is bleeding and the complexion is pale, then we have remedy like China hemorrhagic remedy. But if there is no bleeding, no hemorrhage, then we will use manganum for the pale complexion without any bleeding. So now what we have to study is that the patient is waxy and pale, but there is no bleeding. So this means the anemia is due to destruction of RBCs or hemolysis. So the picture here will be of autoimmune hemolysis, sickle cell anemia, thalassemia, and G6PD deficiency. So these are the hemolytic anemias. So here is the summary that the manganum is metal and psychotic, amelioration from lying down on bed, and aggravation from damp weather, and anemia without hemorrhage. useful in recurrent complaints, and is hardly ever seen in first time complaint. So, thank you for watching.